Hey, good morning, George. This serious respiratory illness has been seen in multiple states so far, with the number of cases climbing, and now vets are turning into detectives trying to figure out just what is making these dogs so sick.
It's the mystery illness affecting dogs nationwide and leaving owners like Lauren Salaya worried about their four-legged family members.
Over the course of about 2 days, she continued to have that dry hacking cough. And it just kind of progressed from there.
6 weeks ago, Salaya from North Carolina noticed her German Shepherd, Maddie, showing signs of what she and her vet initially believed was typical kennel cough, until it didn't go away.
Unfortunately, it is extremely contagious, and our French Bulldog got it as well.
Cases like this now popping up around the country. Kaylee and Ryan from New Hampshire now dealing with the mystery contagious respiratory disease with their 1-year-old Australian Shepherd, Toby.
You're like, do we bring him to the emergency vet?
When he was coughing, he was gagging because he was coughing up like phlegm.
Veterinarian Dr. Lindsay Ganser, who has already treated 35 dogs with the mystery disease, says the first symptom, coughing, can last for weeks.
Starting with a cough, eye or nasal discharge, progressing to more of a wet cough, lethargy, fever, not wanting to eat. So you'll notice that their respiratory rate and effort are increased. Their gums might turn blue or purple.
Now, as 50 million Americans hit the road for the holidays, concerns about their own furry friends brought sharply into focus. Janet on Facebook wondering if boarding her pet is okay.
Most important thing is to avoid any areas where there are a lot of dogs in that space. So avoid boarding them, avoid doggy daycares, going to the groomer, going to dog parks.
Sammy questioning if cats are affected too.
Right now, we're only seeing it in dogs. Typically, bacteria and viruses don't necessarily spread from species to species.
And perhaps the number one question so many want answered: how can we keep our pets safe?
Definitely get seen by a veterinarian sooner rather than later. The earlier that treatment starts, the better chance they have of not progressing and developing into a pneumonia.
Now, don't panic, experts say, if owners do see their symptoms see their pets showing those symptoms of the illness. Instead, they should apply the best practices we learned from the pandemic. You should isolate, then seek medical attention for your pet, guys.
Good advice. Yeah, sure.
Serious dog illness that can be lethal and is being seen in a growing number of states. Vets are struggling with how to treat it. We get more from Miguel Almaguer.
The mysterious respiratory illness is infecting dogs at a worrisome rate as veterinarians now scramble to better understand the possible bacterium pathogen, and more owners believe their pets have been infected.
It's just been a brutal 6 weeks. It's, everything you do for them, nothing really works.
Diane Swanson says her golden retriever, Gus, became severely ill last month.
The night before last, I thought for sure that we were going to lose him. It was just one of those nights all night long that he just could not catch his breath. He would just wake up just gasping.
With symptoms similar to kennel cough, vets say the suspected newly discovered bacterium can quickly progress to pneumonia and severe respiratory distress.
There's a very small subset of the affected animals, at least based on reports we're hearing from clinical veterinarians, that will develop a secondary bacterial infection, and that can be severe.
With a growing number of cases being reported across the country, it's feared the bacteria is spread where dogs congregate, like kennels, doggy daycare facilities, or dog parks.
It's like COVID for dogs.
Symptoms include a cough, fever, or intermittent loss of appetite.
It starts off very similar to kennel cough. And kennel cough is something that's been around for a really long time. We have a vaccine for it. And those patients present with a cough, typical kennel cough. They'll cough for a week to 10 days, and then it resolves on its own. Typically doesn't require any sort of antibiotic therapy, sometimes a cough suppressant to help out. But that's generally what we've seen historically. And now what we're seeing is they present very similarly, where they'll have those same symptoms, that cough, that sometimes is a wet cough. Maybe they'll have eye or nose discharge, but then it progresses and it gets much worse and the cough doesn't resolve. They end up getting a pneumonia. And when they get pneumonia, they become oxygen dependent and respiratory distress. They'll require really aggressive antibiotic therapies, multiple different antibiotics. A lot of times what we're seeing, so we're an emergency and referral center, we'll see them in that pneumonia stage. So we're having to hospitalize them in either oxygen cages or on what's called high flow oxygen, which is high velocity oxygen going in through a nasal cannula to help them breathe. And if we can get them through that pneumonia stage, that cough is then lingering afterward for, at this point, an unknown amount of time, because we're still seeing rechecks of those cases and they're still having ongoing therapies with oral antibiotics and ongoing treatment, and it's not really resolving or responding that great. So we're looking into a lot of different treatment options that are a little bit out of the normal. We're looking into different bacterial infections and sending samples out to a lab at New Hampshire, the veterinary diagnostic lab in New Hampshire, to help see if they can isolate if it is a bacteria. But so much is unknown about it right now. You know, isolating your dog, not letting them go to dog parks, grooming, boarding, anywhere where there's a high volume of dogs in an area in a shared space. That's where we're seeing a majority of these dogs coming from that are very sick from this.
A mystery illness causing respiratory symptoms among dogs across the country may be difficult to determine. WALB News 10's Quinlan Parker speaks with a local veterinarian who shares signs and symptoms to look out for.
Dr. Amber Love at Bush Animal Clinic says if your dog seems to be acting abnormal and have symptoms such as coughing and sneezing and difficulty breathing, you should get emergency medical care.
I wouldn't just want to not do anything about it if it could be something that could potentially be detrimental to her.
Emily Ann Missamore's concern is prompted by the unknown of this respiratory illness.
Feel the lymph nodes.
So what abnormal things should you look out for from your dog?
They'll have like a labored breathing. They can have a nasal discharge, a deep hacking cough, which is a little bit different than the other cough that they typically present with.
And it's kind of scary because I don't know. I mean, she's my first dog that I've had by myself.
Dr. Amber Love, a veterinarian with Bush Animal Clinic, says the secondary complications like pneumonia can in turn be fatal to dogs.
Some dogs are actually developing an acute pneumonia where within 24 to 36 hours they're going downhill significantly and they don't have the best outcome.
Due to the unknown nature of the illness, Dr. Love recommends focusing on prevention, something Emily Ann says she's already got a jump on.
I've just always have been scared about that with her, and like where I live right now, there's like a dog park that I take her out at, and that definitely has been a concern just because I don't know what other dogs have.
Experts say the illness is very similar to kennel cough symptoms. However, it cannot be treated with antibiotics, which is why pet owners should make sure their dogs are up to date on their vaccines. In Albany, Quinlan Parker, WALB, your hometown news source.
States hit the hardest include Colorado, Oregon, Alabama, New Hampshire, California, Indiana, Illinois, Washington, Idaho, Georgia, and Florida, but it's not exclusive to those states. To protect your own dog, the number one thing that you can do is limit their exposure to other dogs, especially dogs that you don't know. And one of the biggest things you can do is prevent them from drinking out of communal water bowls, such as at the dog park. You also want to limit their time at doggy daycare, grooming offices, anywhere that your dog is going to have extended exposure to other animals. Other things you can do is to have quercetin on hand. Quercetin is basically nature's Benadryl, and it can help if this thing is viral. And then also feeding more fresh foods can actually boost your dog's immune system and help their ability to fight off disease. And we're talking fresh foods like meats, fruits and vegetables, other protein sources like eggs, and especially something like raw milk that supports the gut health. If your dog does begin to develop any of these symptoms, do not hesitate to take them into the vet because, like I said earlier, this can turn into acute pneumonia very quickly, and that's when it becomes deadly. If you want help at relieving some of the symptoms at home, Dr. Andrew Jones recommends a few things: honey, green tea, quercetin, like we said earlier, Elderberry extract, licorice root extract, and or slippery elm powder can all be at-home remedies that can help deal with the symptoms that your dog is experiencing. This is a developing story. We're going to keep you posted.
Well, number one, try to limit your chance that your dog is going to contract this disease in the first place. Last time at the really busy dog park, avoid the kennel. And if your dog develops this acute cough, well, number one, I do think it's a good idea, go in and see your veterinarian, get him checked. But there also are some natural antiviral, anti-cough remedies you should consider. Number one, an anti-cough, antiviral tea. Green tea, 1 cup. Local unpasteurized honey, 1 tablespoon. Mix the honey well with 1 cup of green tea. Standard dog dose, 1/4 cup or 60 mils per 25 pounds of body weight, twice a day. The green tea is a great antibacterial and also has some antiviral properties. The honey is great for coughing. It has antibacterial and antiviral properties. Number 2, the flavonoid isolated from apple peel. This is quercetin. Quercetin has specific antiviral properties and it was studied as a treatment for COVID-19. Standard dog dose, 150 milligrams of bioactive quercetin per 50 pounds of body weight daily. Then number 3, slippery elm. It comes from the inner bark of the slippery elm tree and it works really well for coughing. It forms the thing called a mucilage, so it coats the throat, taking away all that inflammation. Standard dog dose, 200 milligrams per 10 pounds of body weight, twice a day. So just be aware of this disease. Try and prevent your dog from getting it in the first place. And if they develop a cough, get them checked. Consider some of those home remedies.